Hi, I'm Dr. Mike Milligan. I'm here with Dr. Jason Wischmeyer, Interventional Cardiologist from Lubbock, Texas. Jason, thanks so much for being with us.
Thanks for having me.
Well, Jason just spoke to our dental group about the importance of oral health to overall health. Tell us a little bit about what you spoke to us about there, Jason.
Well, I tried to speak to the link between cardiovascular disease and oral health or periodontal disease, and how when you consider both diseases separately, they don't seem to have much in common. But in reality, because cardiovascular risk is integrally linked to periodontal disease as an independent risk factor, it turns out what they have in common is mechanisms of inflammation.
Right.
And so they share an underlying pathophysiology.
And I think that the periapical infections do as well.
Mm-hmm.
Any infection in the mouth, whether
Mm-hmm.
it's from the teeth or the gums,
Mm-hmm.
is going to help cause this inflammation. So tell me what you're seeing.
Well, just if we look at just how we practice medicine these days, we become very focused in terms of how we treat people.
Right.
And it's easy for me to say as a cardiologist that I'm going to deal with the heart,
Right.
and that's it. But if you start looking more broadly at your patients, you'll find that their overall state of wellness really can be well defined just by looking at their oral health. So many patients have poor oral health and have diabetes, have hypertension, things that have also not really received much attention.
Right.
And it may be as simple as the patient doesn't realize that these things are tied together and that their overall state of wellness determines how well or how poorly they do in the future.
Right. Well said. So what you're saying is that infection in the mouth isn't just localized to the mouth, but it goes through the entire body.
Absolutely not. That is what I'm saying. It's not just local.
Right.
And I liken it to your neighbor's house is on fire. If your neighbor's house is on fire, don't you think your home is at risk simply from the proximity and the fact that smoke and flame and heat are drifting your way?
Right. Right.
If you have a process ongoing in your periodontal tissues in your mouth,
Right.
and you have plaque in your arteries, be it in the carotids or the heart or wherever,
Right.
all of those mediators of infection are traveling throughout your bloodstream and bathing plaque that is present in other tissues or other locations.
Right.
And those mediators, by definition of what they do, generate and promote inflammation elsewhere. So that's really the link between the two problems.
So what can patients expect their dentist to do? What would you like the dentist to be doing for their patients?
I would love for the dentist to continue to communicate and talk to their patients about their overall health. And I think this is something that has been shifting in a positive way over several years. You used to not have your blood pressure taken at the dentist's office. When I was growing up, nobody did that, but that's pretty common now. You have your blood pressure checked, you have a medical history form that you fill out. And so as a dentist, you're getting a window on the patient's overall health, and you can use that as an entree to talk to them about how good or bad they're doing. And then, of course, it's also important to tell them if they have dental issues, if they have oral disease or periodontal disease, that it's a risk factor for other things, that there's a direct link between that and heart disease, for instance. I would venture to say that most patients don't know that.
I think you're right, but the science is there, the research has been done, and now it's a matter of getting that word out.
Absolutely.
Right.
Absolutely.
Right. What would you like to tell our patients in general about their overall health and cardiac health? Give us a few things that they need to know, that they need to do.
Yeah.
That we all need to do.
I think you could sum it up in a way by saying, you're in charge. And what you do, how you take care of yourself, in large part determines what's going to happen to you.
Right.
Most people, if you talk to them about risk of heart attack or stroke, they don't want those things.
Right.
And they're surprised to learn that it takes years of disease progression before they wind up with those kind of problems. So unless they take the initiative and find out whether they've got a problem or disease, they may not know it. Mm-hmm. And then secondly, the surprising figure that I like to spring on them is, 80% of staying out of trouble in terms of cardiovascular disease mm-hmm. is probably lifestyle.
Right.
So it's more than you realize.
And by lifestyle, you mean exactly what?
I mean having the proper diet, mm-hmm. having an active life, move. Mm-hmm. You don't have to be a marathon runner, but you move and you do things, you exercise, wow. You don't smoke, you avoid alcohol in excess.
Mm-hmm. Get your sleep.
Get your sleep. These are simple things that we can do that make a big difference. Mm-hmm. And, people are also surprised to learn that if you make small efforts in each of these areas, because all of these risks that tend to trigger or make worse cardiovascular problems, mm-hmm. they're all interrelated. Mm-hmm. You're likely to have positive effects across the board. Mm-hmm. So lifestyle is critical to this. And if you have heart or vascular disease, you can't move your risk from being high down to where you want it, which is as low as you can get it, right. without doing lifestyle in addition to medical therapy. You have to do both.
Yeah, very good, wonderful. So a dental patient comes in and they need maybe several hundred or even a few $1,000s worth of dentistry to clear the infection in their mouth, and they say, well, I can't really afford that. What, by not affording that preventive problem for their heart, what might they be in the not
Sure.
too distant future? What might happen?
Sure. We know really without question that cardiovascular risk is tied to dental disease. Mm-hmm. And I would put it back to them. It may be difficult to deal with the work that needs to be done to clear infection or clear disease of the mouth, but think of what the cost would be if you had a heart attack right. that was triggered in part by ongoing oral problems, mm-hmm. or perhaps even more frightening, what if you had a stroke and couldn't work, couldn't move, mm-hmm. couldn't get out of bed? Right. Think of how devastating these sorts of things are. The fact is, if one deals with problems up front, whether it's dental disease or diabetes or hypertension, ultimately it's better economically for the patient and better in terms of what's going to happen to them down the road. Okay? If someone has periodontal infection that needs to be treated and cleared, you can also think of it as you're restoring them back to a balance of normal oral health. Then it becomes a lot easier and less expensive to control and maintain that than it does if you let it go and get worse, and then either, who knows, you lose more teeth, mm-hmm. you have a cardiovascular event. These things can be devastating, so they're better dealt with up front.
Prevention is best, early treatment is next best, and then treat it as soon as you can.
Absolutely,
right.
I agree.
Is there anything else, Jason, that you'd like to tell us before we close?
I'm very happy to hear that there are lines of communication between medical specialties. I think that's a big issue in our country today. Whether you're talking about dentists and cardiologists or internists and cardiologists, we spend too much time focusing on immediate and acute problems rather than working together to treat the whole patient. And a necessary part of that treatment is prevention and dealing with things early. And if you don't communicate and work along these lines, it becomes very hard to do. So I'm glad to see that that's happening.
Where can we get more information?
Well, I think a primary resource for patients is always their primary health care team, whether it's a general doctor or their dentist, their internist. These are great places to start. But patients also need to educate themselves on these problems and issues. I tell everybody that I see that I can't tell you everything that you need to know or do in a 15 or 20 minute visit. You have to educate yourself about lifestyle and diet. There are lots of resources on the web. We have a website that we're building called optimalhearthealth.com, which is going to be linked to my preventative cardiology practice, and it will give information about that. Obviously, American Heart Association, American Diabetes Associations, all of these websites have resources to direct patients to. But you know, another good source is other patients. And that's one reason, at least in my field, I really push people to go to cardiac rehab after they've had an event like a heart attack, because it puts them in proximity to patients who are right where they are or right where they don't want to be. And you would be amazed how much you can learn from other patients who have been through this process. Hopefully they're learning along with their cohorts and their colleagues as well. But there's a lot of resources out there.
Great. Dr. Wischmeyer, thank you so much for being with us.
You're welcome. Thank you.